Douglas Ross.
Well, I think the concerns from these benches were the First Minister apparently disrespecting the presiding officer, who is asking to focus on the issues. And perhaps the First Minister would have more time to focus on the issues about the questions on Scotland's NHS if she didn't try to throw the blame elsewhere around the United Kingdom. Because the unique issue here is Nicola Sturgeon and her government are in sole control of the NHS here in Scotland. So I've asked about the problems in our A&E. I've asked about the issues with delayed discharge. So let's look at another issue that is happening in a part of our NHS where patients are really struggling to get treatment, our GP practices. This week, Dr Andrew Buist of BMA Scotland said this. These are his words. "My real fear is we're at a tipping point, and what we're going to see is areas of Scotland that are under-doctored." He continues, "And that is more likely to happen in areas of higher deprivation, and the care of these patients is going to suffer." First Minister, are doctors right that if you're poorer, you'll receive a second-rate healthcare service in Scotland's NHS?
First Minister.
A great deal of what this government does in the health service and more generally, of course, is designed to tackle and address inequalities, not least the steps we are taking through our social security system to lift people out of poverty and indeed to mitigate the actions of a Tory government at Westminster that is pushing so many more people into poverty. But on the NHS, presiding officer, I was giving, as I think is right and proper, detailed information about the actions this government is taking to address challenges that our NHS is facing. I was making the point, and I think it is an important point to make, that these challenges are not unique to Scotland. They're not even unique to the United Kingdom right now. But if Douglas Ross wants to say this is all specifically about this SNP government, then OK. Notwithstanding the challenges that our NHS is facing, A&E units in Scotland are the best performing anywhere in the UK. Delayed discharges, while far too high, are lower than they are in England and Wales. And on GPs, which I'm going to come on to the question about GPs, there are more headcount GPs per 100,000 population in Scotland than the rest of the UK by some considerable distance. So if Douglas Ross is saying that the challenges in our health service are all about the SNP, then he has to recognise the relative performance of our NHS compared to other parts of the UK. On GPs, again, we are working to increase the numbers in our National Health Service. We have record numbers across many different clinical areas already in our health service. We are working to increase the number of GPs. We've already increased headcount by 277, and that positive progress working with the GP profession will continue. And of course, we are recruiting and supporting the recruitment of other professionals to support multidisciplinary teams in primary care. Final point I would make, presiding officer, is this. It is easy and it is entirely legitimate in this session, or any session of First Minister's questions, to state the problems in our National Health Service. But the job of government is to take the actions to support the NHS to address these issues, and that is the responsibility that the people of Scotland trust this government to do.
Douglas Ross.
I think it's shameful that the First Minister dedicates more of her time attacking the NHS in other parts of the United Kingdom than focusing on what she can do here in Scotland, because it is absolutely clear that more has to be done to tackle the crisis in Scotland's NHS. There's a crisis in our A&E departments. There's a crisis with delayed discharges. There's a crisis at GP practices. And all of this adds up to healthcare that doesn't deliver for patients. For cancer patients, the situation can then be between life and death. We've received a Freedom of Information response from a Scottish Health Board on this issue. It reveals that a patient has waited more than 6 months to start treatment for breast cancer. Another patient has waited 18 months to start treatment for prostate cancer. And worst of all, someone has waited 2 years to start their treatment for cancer. First Minister, That is not good enough. Lives are at risk. The longer someone waits to start treatment for cancer, the less likely they are to beat cancer. So what action will the First Minister and her government take to tackle these appalling waiting times?
First Minister.
Well, firstly, Presiding Officer, there are few areas of the NHS more important than cancer care, for the reasons that Douglas Ross has set out. And obviously he cited individual cases. As always, I am very willing to look at the particular circumstances of individual cases. But it remains the case, even with all of the challenges of the pandemic, that the median waiting time for a patient with cancer to start treatment once a decision to treat has been made is measured in days, not weeks, and certainly not months. It is. I'm trying to answer serious questions in a detailed fashion, Presiding Officer. What I started saying is there will be individual cases, sometimes where the clinical circumstances mean that it takes longer, and sometimes, yes, where failings in the NHS mean that it takes longer. The point I am making is for the vast majority of patients that is not the case, and the median waiting time to start cancer treatment is measured in days in this country, and that is down to the hard work of those on the front line. Now, Presiding Officer, I think Douglas Ross started his last question by saying I spent more time attacking the health service elsewhere than I did talking about the Scottish health service. I've not attacked the health service anywhere. Secondly, I think anybody reviewing the official report of this session will see that that is just factually inaccurate. In fact, the Conservatives were getting impatient because they seemed to think I was taking too long going into detail about the unscheduled care collaborative earlier on. But when Douglas Ross puts it to me that the problems in our National Health Service are unique to Scotland and they are worse in Scotland because of this government, it is reasonable for me to point out that that is not the case.
Thank you.
That despite the challenges that nobody here is shying away from, our NHS performs better than its counterparts in England and Wales. And the only reason I'm saying that is because Douglas Ross is putting the counter to me. Finally, Presiding Officer, it is really important that we continue to support record investment in our National Health Service. It is not that long ago, and here we are measuring in weeks, not that long ago that Douglas Ross was demanding that I cut taxes for the richest people in our country. Had I followed his advice, we'd have had to take investment out of our National Health Service, which is why few people will take Douglas Ross or the Conservatives seriously when it comes to trust on the National Health Service.